Good afternoon, everyone, and thanks for joining us for this, our final COVID-19 press briefing of the week. Today, Orange County Mayor Jerry O. Demings will discuss Orange County's effort in assisting the state with the vaccination process, including vaccination locations for veterans, transportation, 2 vaccination sites for certain clients of Lynx, and a word of caution for some looking to receive vaccinations. The mayor will also give an update on COVID-19 cases, positivity rates, and more. Mayor Buddy Dyer from the city of Orlando was here to bring information regarding what the city is doing to fight the virus there. He will also talk about rental assistance and small business assistance as well in the city of Orlando. From the Florida Department of Health in Orange County, Dr. Rob Pino was here, of course, with his important updates on the vaccination process as well as COVID-19 trending here in our area. We are asking you, our reporters, we are trying to make these conversations, these press events as short as we can, so please, one question only when we come to the Q&A portion of the press conference. You want to be respectful of everyone's time. We begin this with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here this afternoon. This is our last news conference before the upcoming Dr. Martin Luther King Jr. holiday. So I want to acknowledge a few things surrounding the holiday. First, Monday will be the 35th anniversary, marking the King holiday as the first federal holiday honoring an African American. While the holiday always falls on the third Monday of January, Dr. King's birthday is in fact tomorrow, January the 15th. He would have been 92 years old. Tomorrow, in commemoration of the life and legacy of Dr. King, I'll be participating in a food sorting volunteer event with other Orange County staff and the MLK initiative here within Orange County. That will be at the Second Harvest facility. I encourage any of our residents to volunteer at the charity of your choice during this Dr. King holiday season, if you will. That would demonstrate the overall commitment to service to others here within our community. I want to talk a little bit about what's been going on with the vaccinations within our community. I believe they're going to put a picture up just momentarily as vaccinations are being done at the Orange County Convention Center. Our paramedics working very closely with the staff at the Orange County Health Department. And this is 2 of our firefighters doing double duty out there. In addition to administering the vaccine, they changed the tire of an individual who drove there who had a flat tire. So we do recognize firefighters Laney and Larson for their extra duty efforts today. Now, the total number of Orange County residents who have received their shots as of this morning, reported through the Department of Health, is 54,461 individuals. 714 of them are individuals who are not residents of Orange County. The total number of those vaccinated represents about 3.1% of our county population. And that number includes hospital vaccinations and others here within our county. For more information on how to obtain the vaccine, you can go to our website at ocfl.net/vaccine. The next announcement is for qualified veterans. The Orlando VA Medical Center at Lake Nona will be holding free COVID-19 vaccination clinics on Saturday and Monday from 8 a.m. to 4 p.m. The free vaccines are for veterans age 75 years and older, or veterans who receive care at the VA ages 18 and up, and among some of the following professions: firefighters, police officers, corrections officers, plus those who work in the educational sector, including teachers and daycare workers. Again, this is at the VA Medical Center for persons who access, veterans who access those facilities. The VA asks that you do bring identification or documentation that you are employed in one of these categories. The vaccine will be available for walk-ins or by appointment as the supply will allow. appointments are not necessary for that effort. To schedule an appointment, they provided a number for us. You can contact them at 407-631-0499. That's 407-631-0499, or leave a voicemail during non-business hours, and your call will be returned. I also want to make an announcement. I hope this is a bit of good news. We know that our school board has written to the governor to request that school board staff, teachers, and others who are 65 and older be allowed to be vaccinated. So we worked out something with Dr. Pino and the Department of Health, and our staff will be working to do a closed pod for Orange County Public Schools staff, 65 plus. That will be coming up very soon. So we're kind of working out the logistics at this point. So we did want to make that announcement today that here very soon, the teachers and others who are in the 65 plus age category will be able to get vaccinated. We'll do, again, a closed pod. It's my understanding, Mr. Scott Howard is here from the school district, that it's approximately 800 employees within the school district that fit that particular category. We're doing that, obviously, in response to, say that again?
January 24th.
January the 24th will be the day that will be done. All right, so we work quickly here, January the 24th. And, you know, this is, again, in response to some of the inquiries and requests that we have seen here within our community. Currently, links will transport only registered access link clients from their residence to a vaccination site and back home. This is something that we have been questioning about as well. And so, if appropriate, the link service provider will wait in line with the passenger, allowing the healthcare worker to enter the vehicle to have the vaccine administered. Access links clients just need to schedule a reservation for a trip using their normal process. For more information on Access Link, you can visit their website at golinks.com, golinks.com. Unfortunately, the demand for vaccinations has also brought out many scam artists, if you will. Here are some tips to avoid becoming a victim. Know that anyone asking for money in exchange for an appointment, it's a scam. Check with the county health departments for local vaccine distribution guidelines. Be wary of any website where pop-up ads solicit a vaccine appointment. Report suspicious solicitations or COVID-19 vaccine-related advertisements to the Attorney General's office. There's a 1-800 number that you can call. It's 1-866-9, that's the number 9, no scam. 1-866-9-no-scam. Or you can go to the AG's website to report a complaint to myfloridalegal.com, myfloridalegal.com. Now, I'll kind of shift gears now and talk about the numbers. Again, we are approaching another sad milestone within our community. Since the pandemic began, there have been a total of now 90,601 documented cases of positive COVID-19 individuals within Orange County. We are not far, therefore, from that 100,000 case mark. I try to put these numbers into perspective. At 90,000, that's approximately 6.4% of the county's population over time has tested positive for the virus. I wanted to compare that to something. I looked at Miami-Dade County. Miami-Dade County is a county of about 2.6 million with 334,000 persons that have tested positive. So that means that's about 12.8% of their population over time had tested positive. So it's exactly double hours here within Orange County. So I believe that many of the measures that we put in place have worked. Even though the numbers are climbing, I believe that they could be a lot worse than what they are. Without some of these provisions that we have put in place, many more people likely would have been positive here within our community, and many more lives would have been lost. Since our briefing on Monday, we've had nearly 3,000 new cases. The exact number is 2,913. Our 2-week rolling positivity rate is 12.7%, which is slightly down from the 13.6% on January the 10th. A reported 823 Orange County residents have died as a result of the coronavirus. That is an increase of 26 deaths since Monday. That means 26 new families are mourning in our community. They join the hundreds of others. I ask that you hold everyone who has been touched by COVID-19 in your thoughts and prayers. And Orange County Health Services continues to offer free testing at Barnett Park. That location will be open from 9 a.m. to 5 p.m. 7 days a week. And Monday, the MLK holiday, they will continue to do testing at that site. The state regional testing site at the Orange County Convention Center will also be open on the holiday. However, the vaccination site at Orange County Convention Center will be closed on Monday. You can get information from our website at ocfl.net/testing for other details. Our Orange County Health Services staff have been doing a tremendous job of staffing the free testing sites at Barnett Park and assisting the Florida Department of Health at Orange County with the Convention Center operation. Health Services contributes 3 teams of nurses and medical assistants that have been working at the Orange County Convention Center vaccination site since December the 31st. Our health services teams have been offering free testing now at Barnett and other locations for a total of 158 days. Since the beginning of the pandemic, I have stressed the importance of testing as an integral part of our overall strategy to contain and respond to the virus. Our compliance teams continue to be active in our community. They have visited over 6,400 different businesses, and they have a compliance rate of about 99%. Again, I think that's pretty phenomenal. The compliance teams have visited 1,026 businesses and have issued a total of 84 warnings and 17 citations as of today. And finally, I want to thank Mayor Dyer and Orlando City Commissioner Regina Hill for inviting me to a special graduation ceremony last evening. We provided $225,000 in CARES Act funding to support a job skills program, training program that was sponsored by the Central Florida Urban League and Blueprint 2.0. Last night, 84 individuals completed the training, and with upskill training, they're going into new jobs that is putting them back to work, and they're earning a decent wage. The vocational program has assisted local residents whose jobs were impacted by COVID-19, and they now have new skills that will lead to higher wage jobs. Some of the certifications for these students include areas such as a home health aide, certified nursing assistant, apartment maintenance worker, clinical medical assistant. And with that, I'm going to turn it over to Mayor Buddy Dyer. We have a lot else to cover as well. Thank you.
Thank you, Mayor Demings, and thank you for being here. As we continue to see a high number of positive COVID rates, it's easy to focus on the things that we can't do right now to ensure that we reduce the spread of the virus. So instead of focusing on that today, I thought I would highlight a few of the things that we can do safely And we're very fortunate to live here in Orlando with sunshine and comfortable temperatures. We have had just a marvelous last couple of weeks in terms of weather. So to get through these tough times safely, I would suggest that we take advantage of this great outdoor weather we're having. We can meet with family and friends at a distance in your driveway, in your front yard, at one of the many city or county parks. There's so many restaurants that have added or expanded their outdoor dining options, or take food to a outdoor space. We can go for walks, we can go for bike rides, and it's certainly good not only for your physical health, but also for your mental health during this pandemic. We know that COVID spreads more easily indoors than outdoors, so we know that being close to people outside of your home bubble increases the transmission. So it's more important that you're outside than inside, perhaps. Getting outside also reduces the risk of the spread of the virus. So doing so keeps our families and our loved ones healthy and safe. Okay, Mayor Demings mentioned all of the opportunities for distribution of the vaccine. I want to thank our Orlando Fire Department personnel who are assisting Orange County and the Department of Health with the vaccines, especially the seniors who are unable to travel and utilize technology to make appointments. Our firefighters have been visiting senior residents at senior facilities to administer vaccines directly to them. So I want to thank all of the first responders, whether they're city or Orange County or other municipalities. Another way the city continues to support our residents is through rental assistance program. As of the final December deadline related to residential, we've assisted more than 550 households to get current on their past due rent, for a total of over $250 million that the state provided to us. I'm glad we were able to do that. At our last meeting, which was Monday, we approved an item to be able to pursue another $8.6 million in new federal funds that will be available to our residents. As we seek additional guidance from the Treasury Department, we will figure out exactly how those funds will be administrated. Lastly, I also want to acknowledge give you an update on the CRA, Small Business Rental Assistance Program. Since we launched that, 15 businesses have received more than $330,000 in rent payments. So since the inception, we have received 147 applicants, and an additional 395 is planned for distribution. And I want to thank the Orlando Economic Partnership for assisting us in that program. With that, Dr. Pino.
Good afternoon. Thank you, Mayor Demings. Thank you. So the Mayor Demings gave you detailed information on the testing. I'm going to touch a few points on that and then move into vaccination. There were a lot of concerns from our citizens. With the pandemic itself, the highest positivity rate right now is between 5 to 14 years old. Also, with that, those are school-age children. But we know through our interview process that the infections are being acquired out in the community. And we know how difficult it is to control the kids. I have too. But we ask you for an effort to control your children's activities and prevention strategies that you may use at home. It is important to control the pandemic. Although they are not experiencing this disease in the same way that older adults do, it's also important because they serve as a pool from which adults can get infection as well. So that's why it's so important to control that larger pool of people who do not experience the disease as worse as the elderly do. With that also, we have seen some signs of hope in the data. Very glimpses of hope. It's just a glimpse of hope. That's why we are insisting for everyone to please adhere to CDC guidelines, wear your mask, even if you were vaccinated, wash your distance, and wash your hands, and clean surfaces at home as often as possible. Wash your hands when you come into your house from the outside, and before you hug and kiss everyone at home, please clean yourself. We also have seen a decrease on the numbers of ER visits. That's always a good sign. And we have seen a small decline on hospitalizations in general. That's another good sign. Of course, if visits to the ER decrease, hospitalizations are going to decrease because that's what feed the hospital. But what has increased is the number of people using ICU beds. Slightly, but it's an increase. And also what is increasing is the death rate. As you can see our numbers right now, the mayor announced more than 20 new deaths since we talked to you on Friday, and today is only Thursday, not even a week. So that rate is increasing as we forecasted for you a couple of weeks ago. This is what is going to happen. We have control over this. If we use our masks, if we protect our elderly, if we protect people over 65 years old who have pre-existing conditions, we will achieve that. The vaccine is another tool in achieving that, but it's a tool that it will take some time to build up. And as you have seen in the numbers, our ability to vaccinate is exponentially increasing. Now that we have organized everything and structured this pod and other pods that are coming, and pod stands for point of dispensing. So that's where you dispense a medication, in this case, a vaccine. But it's important for people to know that we will get to you, we just cannot get to all of you at the same time. We are using multiplier force. All the EMS department and municipalities are going to engage as we training how to do this process. We are going to start doing churches with EMS and the health department as well. We have done more than 400 vaccination in congregating housing buildings around the county. We will continue with that approach. We are going to conduct closed pods, as the mayor mentioned to you. He has instructed us to conduct a closed pod for the school system. We will do that on the 24th, and we will continue to do that, respecting the criteria established by the state. So it will be a closed pod for employees of the Board of Education, but it will be for 65 years and older of that employed pool. Also, we have found some efficiencies in our process, and we think that we could add another 300 appointments a day. We have not opened the schedule yet because we are working on some details. Among those details was our inventory of vaccines. Today, we got 16,000 Moderna vaccine dosage for the second dosage of the first 16,000 that we got. So if you got a Moderna in the first time that you came to us, we have secured your second dosage and you will come the day of your appointment. We continue to have Pfizer. We have received in total 29,975 dosage of Pfizer, which will have provided 1,000 already to our community, and it's our expectation that we will have the second dosage when your time comes. To answer some of the questions, if you receive Moderna in your first dosage, you will receive Moderna in your second dosage. No one should be concerned about that. If you receive Pfizer, you will receive Pfizer. And if the other twos come, you will receive whatever you have received in the first dosage. Now, we have that vaccine for you right now. What could happen? It could happen that the distribution gets affected for whatever reason. We have the ability to communicate with you through emails that you provided in your registration process and let you know of any changes if those ever happen. So don't be concerned. We have it right now under control as much as we can. The other element, we have little discretion on what we give at the site for the first dosage, because what we have in inventory is what we give you. We will have no ability for the first dosage to let you select which vaccine you want. They are both very similar. They have the same efficiency and efficacy that has been described. And why is that? Because Pfizer especially has a lot of temperature control regulations in place. And when we defrost Pfizer, it cannot be refrost. you defrost it, you have to use it. So that's why forecasting how many people we are expecting, and that's why it's so important that you cancel your appointment if you are not planning to come, because we are constantly looking to the data, and the dashboard is telling us how many appointments we have the next hour, so that we prepare the vaccines that we have for the hour. It's quite an intense process that we have put in place. But the idea is to minimize waste. What is vaccine waste? Vaccine waste is when, for whatever reason, you cannot give that vaccine to a person that you have already drawn from the vial. Because when you draw, you cannot put it back into the bottle. It's like the genie, you can never put it back. So we have waste calculated into our system, and I'm happy to inform that we have not wasted any vaccine so far. How we do that? It's a juggling game. It's at the end of the night, we may have to switch to Moderna, and that's why we're holding a couple of bottles of Moderna, because the temperature control system is a lot easier, and we have less risk of wasting the vaccine. Because if we're able to use Pfizer at the end of the night, and we have 20 dosage, we cannot use it the next day, because it expires quickly. So that's part of why someone in the morning may receive, or during the day, may receive Pfizer, and then a family member that comes at 9 o'clock may receive Moderna. We have control over that. And when you come for your second dosage, another question that we are getting a lot, we will know which dosage to give you. We have several layers built into the system to prevent error. The first layer is your reservation will say which vaccine you got. Your car will say which vaccine you got. If you lose your car and you made your reservation with our system, a copy of your car is in your profile as well. It has everything. It has the lot number and the dosage that you receive. When they scan you again, it will give a sticker that says which dosage you are going to have. When the nurse scans your sticker to give you the vaccine, it will tell the nurse what dosage to give you. The vaccines are going to be both in color-coded coolers to differentiate each of the vaccines. Each vaccine is in a different needle, in different syringe. The syringe that we're using for Pfizer is different than the syringe that we use for Moderna. They are color-coded too. The vaccines are different. Moderna is cloudy, Pfizer is clear, like water. And at the end, before the nurse gives you the vaccine, she's going to ask you what you got the first time. So there are several layers built into the system to avoid any type of error of that kind. Also, as we're going to announce soon when to open the portal for more appointments, we encourage you to download the app for the county, OCFL Alert. We will announce it through the county through there, or to add us at your tweeted at DOH Orange. It will also be announced simultaneously in our Twitter feed. With that, any questions that you may have, I will be willing to answer. Thank you.
Okay, just as a reminder, if we have any Spanish-speaking media here, we have translators here, and we're joined now by Commissioners Uribe and Gomez Cordero. They too are fluent in Spanish, and of course, Dr. Pino is fluent. With that, we'll open it up for any questions. And by the way, Hannah, who moves the mic around for us, today is her birthday.
Happy birthday.
It's her 25th birthday. Hannah's working hard today, moving the mic around and doing other things. So I'm glad she's the one that gets to kneel down at 25 years old. She can still do that. Well, we know Lauren Seabrook has questions for you, Dr. Pino.
Yes, Lauren.
Lauren Seabrook, Channel 9. Dr. Pino, when you talk about how the hospitalizations and the ER visits are down, but the ICU visits are up and deaths are up, does that tell you that we've sort of reached our peak after the holidays, or what should we read from that?
So still not a trend. The hospitalization declined 2 days in the road and went a little bit up and declined again 2 days in the road. And we have seen that before, and that always precedes a decline, a stable decline. So I think that, and this is just, me talking, I think that what's happening is everyone has returned home. The trouble is over. We, as the mayor mentioned, are better off than many other counties and municipalities around the country and the state. So now there has been probably 2-3 weeks since the last holiday. What is today, the 14th? So 2 weeks since the last holiday. Now it's right on time, 2 weeks after, to start having the pandemic that is our pandemic, not the one that people acquire from traveling around. I don't know if that, but, well, the infections that we are start to getting now were infections mostly acquired here, because now we are going to, what we are now experiencing are the infections that were acquired through travel. So it could start declining, and we hope that we start declining. A couple of days, maybe 3 or 4 days in the last 2 weeks, we have a couple of days with less than 1,000. Which was the norm before. Every day was 1,000. We have 1 day with 800 yesterday, I believe, and a couple of days before that on the weekend we have like 700. So there are some signs in the data, but death rate and mortality rate and ICU hospitalization rates runs behind. So it will take us 2 or 3 weeks to see those rates declining if hospitalizations continue to decline.
I will need the help of Ms. Ilia. Mi pregunta tiene que ver con la próxima inauguración presidencial del 20 de enero del presidente electo Joe Biden. Si les preocupa tanto al alcalde Buddy Dyer o a Jerry Demings alguna manifestación que se pueda presentar en favor del presidente Trump y si tiene algún plan concerniente a eso.
The questions are both for Mayor Demings and Mayor Dyer, and it's regarding the next presidential inauguration coming up for President-elect Joe Biden. Are you concerned about any manifestations in favor of exiting President Trump? And if you are there any plans that are being considered to address that concern?
I intend to attend the inauguration in Washington, D.C. As a guest of my wife.
Will you repeat, Mayor? I'm sorry.
Okay. Are you with me so far, Ilya? Okay. I intend to attend the inauguration in Washington, D.C. as a guest of my wife who serves in the 117th Congress.
El alcalde tiene la intención de visitar el evento de inauguración como un invitado de su esposa, la congresista Val Demings.
Based on conversations I've had with her and various briefings that she has been a part of, there should be a safe event in Washington.
Basado en conversaciones que ha tenido con su esposa y en varias actualizaciones que ella ha recibido, el evento debe ser un evento seguro.
I've also had conversations with various law enforcement officials here locally, and at this point, there's no indication that any violence is planned for our community.
Ha tenido conversaciones también con las autoridades de ley locales y hasta el momento no hay indicios de que eventos como tal o haya alguna amenaza para nuestra comunidad.
However, the various federal, state, and local law enforcement agencies here have engaged in contingency planning to respond if the situation calls for a police response in our community.
De todos modos, las autoridades policiales se mantienen planificando constantemente y tendrán una respuesta en caso de suceder un evento, suscitarse un evento.
The incoming administration has suggested and requested that American citizens not travel to Washington, D.C. To participate in the traditional inaugural events.
La administración entrante ha solicitado a los ciudadanos que por favor no viajen al evento de inauguración del presidente electo.
So I won't be in D.C., and I'm not married to a member of Congress. But I've had my share of inaugurations already, and the last one I went to was plenty cold.
El alcalde Dyer informa que no asistirá al evento de inauguración del presidente y que desafortunadamente él no está casado con una congresista federal.
And one thing that I've always been proud about Central Florida
Una de las cosas de las que está muy orgulloso de Central Florida o de la Florida Central
is the relationship between various law enforcement agencies from the federal level to the state level to the local level.
Está orgulloso de las relaciones que tienen las autoridades de ley a nivel local, estatal y federal.
So the ability to share information and be prepared together for whatever may come.
Tienen para compartir información, para estar preparados para cualquier eventualidad.
There has been no indication of any extraordinary activity that is going to occur in our community.
No hay indicio de que haya alguna actividad extraordinaria que vaya a suceder en nuestra comunidad.
But I want to assure our citizens that we are prepared in the event that something out of the ordinary could occur.
Pero quisiera asegurarle a nuestros residentes que estamos preparados en caso de que suceda alguna actividad.
I want to add one other thing.
El alcalde Demings quisiera añadir algo más.
We're pretty fortunate because we have the Central Florida Intelligence Exchange, a fusion center that has federal, state, and local law enforcement officers assigned to it.
Estamos muy afortunados en la Florida Central, pues tenemos un intercambio de inteligencia entre autoridades de ley a través del Florida Central.
And the Fusion Center is one of only a handful in the state of Florida.
El Fusion Center, como él le llama, es uno de pocos que hay a través del estado de Florida.
And because of it being located here, the flow and the sharing of intelligence information real time is very efficient.
Por este centro estar localizado acá en nuestro condado, el flujo de información es más rápido, es muy eficiente.
Other questions?
Hi, Lara Greenberg, Fox 35. This question is for Dr. Pino. There was a pandemic meeting, as I'm sure you know, in the Capitol today with Jared Moskowitz speaking at that. And he spoke a little bit about people who are under 65 but who are immunocompromised and their ability to get vaccines, saying that, this is allowed under the executive order. Can you go into that and, whether that's happening here in the county and what that process looks like?
So I don't have any additional information on that one, and we have not received any additional instruction from the state. But of course, anyone with pre-existing conditions is always a concern, and we hope that we can quickly adapt when we receive those indications. But also, just to keep in mind, in our space here in Orange County, Advent Health did open a drive-through for the patients who are 65 years older. So it's also safe to assume that hospitals and other clinical providers may be directly involved in providing those vaccinations to people who have pre-existing conditions that they can attest to it better than anyone else.
Nikki Zizaza with News 6. This question is for Dr. Pino. Dr. Pino, there was a report that came out from the state basically indicating that they're going to launch a COVID registration website to kind of streamline some of the technical errors that we've been seeing. Is that something that Orange County, because from my understanding, it's optional for counties to participate. Is that something Orange County is going to adopt? What are talks about that?
That is true. The state has or is in the process of acquiring technology that will allow to all the state-sponsored sites, and we are one of those state-sponsored sites, to go into that platform. It is not mandatory, although they are highly suggesting that we should, and also the state will be paying for the cost of that. What we have right now has been shared cost between us and the county, and of course we were looking into that platform to reduce the cost to our residents and taxpayers.
Dr. Pino, I too have a question for you. This is Sharon Stan with News 13. You mentioned the age group 5 to 14 specifically. The American Academy of Pediatrics did a study saying hospitalization rates had increased for pediatrics. Is that something we are seeing in Orange County as well, or?
Not really.
What are we,
but
why that
yes.
age group then?
And there is I have seen also some reports that the new strains of the virus may be causing a higher level of acuity in younger population, but no, we have not experienced that we can see in the data. Remember, if it has been to 2 or 3, 4, 5 people, we will not readily see it. But if it happens in large volume, it will blip in the data.
Steve Hudak from the Orlando Sentinel, and you were really blushing when they said it was your birthday. So happy birthday. This is for Dr. Pino as well. I had a conversation with Public Safety Director Danny Banks about, I think, 190 different firefighters and paramedics have been trained to administer vaccinations. They are now visiting, as I understand it, senior living communities, not nursing homes but places that are 55 plus. You mentioned churches. How soon will that start? Will it be the same kind of teams from the firefighters and EMS? And will it also be limited to 65 and over and have the same kind of restrictions? I know that sounds like a bunch of questions, but it's really about the same topic. Sorry, Jeff. Please don't kick my butt.
So the answer to all of that is yes. So again, we progressively will increase our outings into the community and going deeper. We are doing some data analytics. We are not blindly going to these communities. The communities that have been selected and the order they are selected is based on number of positive cases that we had or where they are located, if we have a higher rate of death in that zip code. There are different formulations that we use to develop a priority list that we also share with the fire department. Now, remember that I mentioned to you that the least problematic issue of giving a vaccine is the vaccine itself. You give it, you're done. But everything that comes before and after is what makes that process flow and be conducive. So from not having the seniors in line and how you registered and how you offer comfort while they are waiting to when they are going to wait the 15 minutes after. And having the paramedics there and having access to bathroom and where the walkers are going to be stationed or the wheelchair. So there's a lot of things, that preparation that goes into this. And the data collection, what is the information that they have, the insurance. And many of them do need help accessing the computers. So it's a very intense process with our seniors. With that, we will continue to follow the guidelines from the governor's office, and whatever we visit will be 65 years and older. When those guidelines change, we will include more people and probably revisit the same places. We at the health department have created a IMT structure for mobile pads. That's an incident management team structure that will be able to manage quickly these pods. Why we did that? Because it was happening that the convention center was taking 100% of my time, so that we need to have a separate structure that we'll be able to quickly authorize, mobilize, and get into the field if needed. Also, the fire department are very eager to participate. We have trained as many, and we will continue to train. And as soon as we feel that they have adapted our protocols and procedures to give the vaccines, we will give it out. A little detail on that, which is important, is who has custody of the vaccine. If we have custody of the vaccine, so Advent Health received direct shipments, Orlando Health received it, and other places have received direct shipments. Some of the community health centers, we transfer 1,000 vaccines to UCF, which is going to do the 65 years and older. But if we have custody of the vaccine, we want the protocols and procedure to be our protocols and procedures, so that the vaccine is given in the way and mode that we have prescribed. And because we feel responsible not only for giving the vaccine, but also to prevent the horror stories that we have seen happening in other places that we don't want to have in Orange. And that's why we have been methodically going step by step, and when we consolidate a step, then we expand, and then we move to the next phase, and we expand. So the churches are going to be done probably on Sundays or afternoons, so that the members can participate, and it will be a mix between the fire department, EMS, and ourselves, and they are a force multiplier. And let me tell you, and I know my nurses are going to be not happy with this, but the EMS right now at the convention center are the best vaccinators, are the faster, they can do 2 vehicles at the same time, and are the ones that never want to leave, don't want to take the break. At 7 o'clock, I have said to them, hey, let's go. I have no, we want to stay to the end. Let go, you nurses. Totally dedicated troop. I mentioned to fire chief, although he said not to think about it, that if they want, I will hire them. But the chief said, don't do it because I will never talk to you again.
Okay, good afternoon. My question is coming from Ryan Lynch from the OBJ for Mayor Dyer. What kind of continued demand are you expecting to see related to the business support programs like the CRA rental assistance?
Businesses are still hurting. So I know there's both in terms of residential rental assistance and business rental assistance. There's a continuing need. So we look to Congress to continue to provide additional funding. And I know that they have passed a short-term act, or an additional act, but we anticipate with the new administration, but there's going to be some additional funding that comes in through local governments.
All right. I know that was a lot of information to share with you, but hopefully it all was important to you. Due to the MLK holiday and the inauguration next week, we will likely only have one news conference, and that will be on Friday, January the 22nd. So thank you all for joining us here today. We hope that you stay safe.